So we had seen about renal tumors also. Let's move on to urine microscopy. So whenever you see a urine examination, other than the physical and chemical examination, when you see the microscopic examination, you'll have to look in for three things mainly. Firstly, we'll have to see about the cells, then the presence of the crystals and presence of casts. So in cells, what are the cells we can see? It can be an RBC, it can be a WBC, or it can be tubular epithelial cells. So RBCs, whenever they are more than 3 per hyper field, so more than 3 RBCs per hyper field, then you call it as hematuria. So microscopic hematuria, even with 3 RBCs, you can call it as microscopic hematuria. And whenever you have RBC hematuria, you will have to look for the morphology of the RBCs. So if they have normal isomorphic RBCs, the normal RBCs, then it will be some non-glomerular diseases like a calculus. So calculus can also cause bleeding, right? So that kind of morphology will be seen in non-glomerular diseases. However, dysmorphic RBCs, if you see some distorted or dysmorphic RBCs like this, then it is going to be related with some glomerular disease only. So what kind of glomerular disease is present with hematuria? Yes, it is nephritic syndromes. So nephritic syndromes, you see dysmorphic RBCs in the hematuria. So WBCs, when you see in urine, you call it as pyuria. So any kind of infection will lead to pyuria. So what was the example? Chronic pyelonephritis. There you see pyuria. Then you also, and also in UTI also, urinary tract infection, you again get pyuria. Then epithelial cells, various epithelial cells, tubular epithelial cells can also be present in the urine. Then we'll see about the various crystals. What all crystals can we see in urine normally? So calcium oxalate, calcium carbonate, urate crystals, then triple phosphate crystals, cystine crystals, tyrosine crystals, and many other abnormal crystals related to drug usage can also be seen. So let's see it along with the image-based questions. So here, if you see, the first image will be that of a calcium oxalate crystal, and in calcium oxalate, we have both dihydrate crystals and monohydrate crystals. Dihydrate crystals is the one which looks like this envelope. So doesn't it look like this envelope shape? So remember, in envelope, you are putting these two crosses. So it is going to be dihydrate. So calcium oxalate dihydrate crystals will be envelope shaped, while calcium oxalate monohydrate crystals will be dumbbell shaped like this. So here if you see, this is a dumbbell, right? So monohydrate will be dumbbell shaped. And already also we saw ethylene glycol poisoning can also result in the formation of calcium oxalate crystals. Then next crystal will be calcium carbonate crystals. So here it is going to appear like these spheres with striations. So from the center you see striations radiating towards the periphery in this sphere. So this kind of morphology is that of a calcium carbonate crystal. Next one will be urate crystals. So various rhomboid shape kind of urate crystals can be seen, and here you will be seeing mostly along with gout. So gout is a condition wherein you see increased amounts of uric acid. So uric acid can also crystallize and form these urate crystals. Then you have this triple phosphate crystals of this. We have already seen about this triple phosphate crystals when we were discussing xanthogranulomatous pyelonephritis, right? It was associated with protease infection. And here we had the struvite stone formation along with the triple phosphate crystals. So triple phosphate crystals was this coffin lid shaped. The next crystal will be cystine crystals, usually associated with cystinuria. So cystinuria is a pathological condition. So cystinuria can present with these hexagon shaped crystals called as cystine crystals. Then in tyrosinemia, again a pathological condition. So in tyrosinemia, you see increased amounts of these tyrosine crystals which are forming these sheaves of needles. So needle-like bundles of these needles can be seen, which are called as tyrosine crystals. Then we'll see about the various types of casts we see in urine. So about hyaline cast, I already spoke. It is going to be produced by the Hennell's loop, and from which they produce the Tam-Horsfall protein, on which other casts are being formed. So this is the basic cast, which is normal, and if you see, it is quite transparent, right, with regular kind of edges. So this is a hyaline cast. So on this, if you see RBC is getting deposited, so it is called as an RBC cast. So where do you see RBC cast? So it is seen in any kind of glomerular nephritis, nephritic syndrome presentation. And if you see WBCs on this hyaline cast, it is called as a WBC cast, and it was again present in infectious conditions like chronic pyelonephritis. Then thirdly, we saw about muddy brown cast. Again, it was the necrotic tubular epithelial cells which is being deposited on this hyaline cast, forming this muddy brown cast, which was seen in acute tubular necrosis. Then we have lipid cast. Lipid cast also I already mentioned in nephrotic syndrome. So there was hyperlipidemia associated with hyperlipiduria, which forms this lipoid nephrosis in the proximal convoluted tubules, right? So after that, it also forms the cast. This lipid gets deposited on the hyaline cast and form this oval bodies kind of structure. So these are called as lipid casts seen in nephrotic syndrome. Other than that, we have this broad waxy cast. So these casts are quite large, right? So normal cast was of this size only, but this is quite large. So this kind of large cast with these kind of some, what do you call, some kind of defect is there. So it is not regular. So it's not regular. It is going to have this kind of damaged wall. So this is called as a broad waxy cast, and it is characteristically seen in chronic renal failure. Okay.